Rogers TV.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. Throughout COVID-19, Rogers TV programs are informing you and your family of resources and services that are available during this pandemic. My name is Carol Merton, and before I welcome our first guest, I would like to express a few words of thanks. In phase 3 of the reopening of our province, we celebrate the lifting of some of the restrictions and are hopeful that we can continue to move forward as school resumes and as the weather changes and we spend more time indoors. There is no doubt that all of us have an important part to play to keep each other and our community safe by continuing to be aware of and following the recommendations provided to us by the Public Health Unit. We know that the situation is fluid and we must stay vigilant so we can continue to experience and enjoy the relaxation of some of the restrictions. We also know, however, that this situation can change as the number of COVID-19 cases continues to be monitored very closely by the public health. Without a doubt, we in our community have forged new linkages, unique and unexpected alliances and networks as we continue to meet the needs of our community in this pandemic. We are all anxious to have our lives get back to normal, and we know that the new normal looks very different than it did a few months ago. We are anxious to move forward, and those on the front lines are weary. Thank you to all in our community who continue to provide the supports and services needed. To the Public Medical Officer of Health, the Public Health Unit staff, and all of our frontline, essential and community support services for their ongoing efforts to keep us safe. We will get through this together, and we will be stronger than ever. And on that note, I would like to welcome Dr. Arra, who is the Medical Officer of Health for our Grey Bruce Public Health Unit. Dr. Arra, thank you for joining me today on HealthLink.
Thank you, Carol, for having me. Always good to be here.
Thank you. So I'm delighted that you're going to be here because I'm keen to hear the update from you. You've been excellent at communicating all along about COVID-19, but we're entering into another new phase, meaning school going back and weather changing. And I'm wondering if you can give us your perspective on what you think this will hold for us and what you need from us as a community.
Thank you again. Your introduction really touched base on many things that are great. And if we repeat them many, many times, they're not going to do them justice. To thank people who have contributed to the relatively positive situation we have. As you mentioned, healthcare workers, the public, the different levels of government, public health recommendation. There is another pillar there in that group that is rarely mentioned, although it is really the front, which is the media. Without a doubt in my mind, your work, Carol, and other people around the table, whether it's the press or the different media outlets, have saved lives over the past 4 or 5 months. We have 0 deaths in Grey Bruce. We continue to maintain 0 deaths related to COVID in Grey Bruce. That's an accomplishment on its own. You know, if you compare I use the word relatively positive because there shouldn't be positive about COVID. However, this is as good as it gets. When you look at countries in Asia that had control over the outbreak, they lost an arm and leg to do it. They used methods as extreme as welding doors to keep families in isolation for 14 days. In Grey and Bruce, we achieved these results with the public being informed, engaged, concerned, but not afraid. So the heavy lifting really happened through the public being concerned and engaged. And the rest of the pillars you mentioned, and I referred to, whether it's the healthcare system, public health, the government response, have been essential in supporting that heavy lifting that was done by the public. It is positive all around. However, it's not the time to let our guard down. We're heading into, we have been in stage 3, but we're heading to a different part of stage 3 where there are two main factors that might come into play or will come into play. One of them is school reopening, and we know that the dynamics of the outbreak might change. We don't know how much it will change. Is it going to affect the dynamics in the community? Definitely. If there is a significant change within schools, this virus does not respect boundaries or organizations. Any potential outbreak in a school could have spillover in the community. The second factor is the cooler weather, and it's not specific to the characteristics of the virus. Rather, it's the behavior of individuals. We all know that during winter and cooler weather, we spend less time outdoors, and we know the transmission of the virus is higher. The risk of transmission is higher indoors. So we need to be vigilant going forward to ensure that the things that kept us safe in the past few months to continue. And more or less, they end up in a list of 3 W's, which is watching our distance, 2 meters or more, washing our hands quite frequently, and wearing a mask correctly. And those have carried us forward. And I know some people of the audience right now would be wondering, but we didn't use masks in March and April. The simple answer, yes, we did. Our masks were big enough to hold us. They were our houses. Everybody was in complete shutdown. And that's why recommendation of a mask would not come in the mitigation stage in March and April. Rather, it comes in the reopening stages, more specifically the 3rd stage.
That's really a helpful understanding for me about the house being a mask because we were enclosed. I thank you for your comments about the media. I have to be honest, I wouldn't have thought of it that way, and I appreciate your comments about it. One of the things that I've noticed that when I watched a variety of medical officers of health speak, your goal is to inform and educate, but not to alarm, although sometimes the messages can be alarming. This may not be a fair question, but how do you manage to stay calm when all of the others around us, sometimes we're very anxious and there's many people who are frightened. I mean, for sure right now, parents are frightened about their children. What is it about the medical officers of health that you're able to carry forward the message with the demeanor of calm, non-anxious presence?
So the short answer is facts. If we know the facts, there will be no fear, there will be concern. Concern is useful. You can utilize it to change behavior. Talking about individual level or organizational level, if I'm concerned about the virus and I know the fact, I'll watch my behavior, keeping distance, protecting myself, protecting my family. That's on the individual level for all of us. So if we ensure that we provide the facts, we provide the picture, the situation at large, and give people the information so they can make their decision based on their individual risk. That's, I guess, the short answer. But the long answer is risk mitigation and risk communication are subjects in the training of public health preventative medicine. It's a specialty of 5 years, similar to surgery or brain surgery. It's 5 years of training, and communication is key. Anything we do, we need to communicate about. And if you can picture 2 axes, one of them is the risk, the hazard, and the other one, the y-axis, will be the outrage. These are not congruent all the time. We could be very upset about something that's not upsetting, and I'm talking about the whole public. They could be, or they could be not concerned about something that's very important. it's very important on those two axes to try to tailor the messaging to where the public is at the time. So if they're not aware of COVID like it was in January and February, we need to provide more information that we need to be prepared for this. If people were very outraged or concerned or anxious, we need to provide the information to bring them back to that happy medium that this is manageable. And this process is not done by one individual. I have a team of people who are looking at the social media, looking at the media, looking at our phone and line calls to assess where the public is at a certain point. Because you can appreciate if people are not concerned and not aware of a hazard, they're not going to act. And if people are aware, but they are anxious or outraged, they're not going to act in a way that's going to protect them. It's really of critical importance to provide information for people to be aware of things and have the knowledge and the tools to address that risk for themselves or for the family. So back to your question, how come usually MOHs are calm in delivering that message? It's the knowledge, it's the training, how to communicate, and truly, this is a job that we're trained for, and if we are not going to provide the best that we can at this point, there's no point of being in a position to start with.
So what you're really saying is public health is always taking the pulse or the temperature of public information, knowledge, and awareness. So you're continually doing a health check on the public. Yeah. Not just a COVID check, but a health check on the public information and awareness.
I like the analogy of taking the pulse and the temperature. It's definitely is. Like at some point there was a need to close beaches to send that message to the province to say we're not open for business yet. But later we were in a position to open the beach, and you would find people anxious, like, the visitors are going to bring the disease with them. Well, some might. However, we all can protect ourselves, and now we have the luxury of time to looking back. Those decisions were right. There were people who had the disease. However, there was no transmission.
Yeah. So I would like to talk to you about the mask policy being extended, or the mask, what is it we would call that? The rules, the regulations, the direction. If you wouldn't mind speaking about that and the reasons, and certainly if you wish to say anything about mask wearing. And then I'm wondering if you would mind addressing every fall season, we look at the regular influenza vaccination and how that fits within the COVID-19 scene.
Two excellent subjects, Carol. The first one, the order section 22 from the MOH to mandate mask use when appropriate indoors in public places was renewed very recently for one more month. And again, it's the same reason since we started in July, to buy some time for municipalities to have more of a solution related to a bylaw possibly. So I've been working with the two counties on drafting a bylaw that if the council decides to pass, it will replace the MOH order. And it will be, again, a bylaw that if it's in place, it will be temporary until we reach herd immunity, hopefully through vaccine. The mask is, again, one layer of intervention, and it's not the silver bullet on its own. It provides benefit when social distance, physical distancing is not guaranteed. However, it does not stand on its own. We need to do all the other things, washing hands and keeping all the measures in place. So that's in a nutshell where we're at with the order versus a bylaw. And it's worth mentioning that almost every jurisdiction in Ontario had considered one of three legal vehicles to mandate masks, whether it's the MOH order, bylaw, or a letter of instruction from the MOH. All of them have been reviewed and shared by medical or public health specialists and by legal specialists. and there has been many exemptions within them that the public has been aware of and comfortable with to know where the exemptions could apply. The second question you asked was about the influenza vaccine or the influenza season starting in the near future. Influenza and COVID have very similar symptoms, and that will be complicating because we need to assume any person has COVID until proven otherwise. So if we can pin down one of the two variables with a vaccine, that will be very helpful. So I strongly encourage people to get the influenza vaccine, and it will be provided as soon as it's available. The vaccine is produced usually during the summer to be available for October and November, and will provide the service as public health and through the healthcare providers and pharmacies like usual. There is something there that is a trade-off when it comes to influenza during a pandemic. The measures we have in place for COVID would prevent transmission of influenza. And if you look at the curve for influenza in March, it really was stopped in its track. So that's a really good thing that all the measures that we implement and have all of us will actually help us for both diseases.
So you recommend that people still proceed with all of the precautions and the influenza vaccine, because I would think if you don't catch influenza, your immune system would be stronger and better if, heaven forbid, COVID-19 was something you came in contact with. Am I right? Or are they connected at all?
And there could be a connection there. If somebody was weakened by influenza, they might have a harder situation dealing with another disease. But truly, the bulk of it is if the system is going to be dealing with each person who has cough as a COVID, and we have double the number from influenza, that's going to really overwhelm the system, and it's going to affect many functions in the society and the health of people. And yeah, you're right in saying that, both diseases are not pleasant to have, and having both of them might make things worse.
Yeah. So before we get on to the COVID-19 app, because I would like you to speak about that, I notice people out and about with their masks, and they won't necessarily, they'll just have their mouth covered or not necessarily their nose, or can you advise whether people need to be covered both with their mouth and their nose when they're using a mask?
Definitely, that both should be covered, and that's using a mask correctly. And I would advise people to spend 2 minutes on our website. There is a video how to wear a mask correctly, how to use it, and it would probably be beneficial for everybody to spend a couple of minutes on the website every day, because there is always new information and related information that can help people make better decisions. Again, there are rumors there, and there are the conspiracy theorists and many things that sometimes you look at these things, how did they actually exist? And I realize people are receptive to information, so getting the information from a credible source, whether it's the Health Unit website, CDC Atlanta, Public Health Agency of Canada, or Public Health Ontario. If a person spends a couple minutes on these websites, truly you can make better decisions for yourself, for your family, your kids, and your older loved ones.
Yeah. So be informed from a credible source. So I'd like to talk a little bit about the COVID-19 app. I want to tell you, I have it on my phone, and I'm wondering if you would describe it and why it's in existence, and how it works for people who may have not considered it or have some concerns about it.
Yeah, so this app is truly is another invention related to this pandemic. It would provide an added layer of protection, and it would provide more specifically some ease in contact tracing. So the app itself would be a software on the phone. A person can have full control on when to activate it or not, and it will detect other cell phones that carry a similar app and the code will be generated and will be sent to some cloud on the internet to be stored there. Then when a person gets infected, becomes a case, they need manually to enter that code that will be given to them based on being a case. So that will ensure that the system is not going to be abused. Rather, only people who are cases can enter it once. As soon as the app receives this code, they will basically pull back all the codes from the cell phones that they have met before. This pullback is not going to be obvious to any person. It's not going to be received by the person who was a case, who the cell phones are. Rather, a message will be generated to all these cell phones that crossed paths with that cell phone, and there was enough proximity and distance and length in time to ensure that any person who would receive that message to saying you might have been exposed, you need to be seeking assessment. That's in general would work really well, will be very effective if 50-60% of the population use the app. And that's why it's important for anybody who has not downloaded it or has not used it to actually do that. Is it going to be a complete replacement of contact tracing? No, it's not. No. Again, it's an effective tool in a toolbox, not a panacea on its own.
So it's free, and people can download it from the website, the government website, right? The COVID-19. Yeah.
Correct.
What I appreciate is it's de-identified, so it's basically cell phone talking to cell phone. I kind of think of it when you're in bumper cars, you know, it just, whoever your bumper car happens to have come into contact with, that's the people that your phone's going to identify, or the phones that you may have been at risk for. What gives me comfort is I get a message from the app that says, you have not been in contact with anyone who has been COVID-19 positive. And it makes me feel confident, still with precautions in place, that there's a certain comfort in getting that message, which I would not have thought of. But what percentage do you think we are at as far as the uptake for the app on the phones? Do you get that information at all, Dr. Arra? Meaning, what percentage have the app downloaded?
I don't have this information, Carol. I can definitely ask for it and share it in the next time we meet. My understanding, it's not as high as 60% that we need to have.
Yeah. The one thing that also gives me comfort is to know that it is confidential. Like, there's none of my personal information that's accessible at that point. It's more when I get the message, it's my responsibility to go and get, if I'm alerted, to go and get the COVID-19 testing done. So, because I know people are very careful about their personal information at this point in time. So, rightly so. So I'm wondering if there are other topics that you'd like to discuss. What I'd like to know is, when is the vaccine for COVID-19 potentially going to become available? We've talked about influenza vaccinations, but what can you tell us? I know you don't have a crystal ball necessarily, but do you have some sort of time frame?
Yeah, so I'm cautiously optimistic we will have a vaccine that is safe and effective, and those are the two criteria for a successful vaccine. We will have it by the end of this year or early next year, and usually it takes 3 to 6 months to mass produce it, to distribute it to the public. Many efforts have been put in place to speed up the process of the vaccine, and it's worth mentioning from all the reviews that we see, specifically from CDC, Atlanta Center of Disease Control in Atlanta, United States. It's one of the most credible public health agencies, that the process was sped up. However, it's not on the expense of safety. There was investment and risk related to finances. So there was, in the first months, around 11 candidate vaccines. Right now, there's over 150, and there are at least 20 in the third stage, which is the final stage. What the risk that was described was these companies start producing the vaccine before it is safe. So if it is actually safe and effective, it will be used, and that will be good. They sped up the process. If it is not safe or not effective or not both, the risk would be financial loss of all that process. That's a question that I received from a couple of people. What is the risk there that people talk about? It's financial risk. Usually there is, again, 3 to 6 months of production and distribution. For us in Grey Bruce, we have a plan of distribution already in place to hit the ground running as soon as that vaccine would be available. It's worth mentioning that, measles back in the day was as scary as COVID. And now a healthcare provider, a physician or nurse might go through their entire career and not see a case of COVID, of measles. Similarly, whenever there is a solution through a vaccine, that will be a good outcome. And again, I would encourage people to get all the information about that vaccine at the time, and we'll provide all the messaging. More or less, that will be the end of this year where we'll get the vaccine. Cautiously optimistic again.
Yes. Will you be prioritizing who gets the vaccine? Like, are you going to be introducing it in gradual stages, or will it be just open to everyone when it's available?
Usually with these decisions, there's a committee that would look at who needs it first, and based on the disease and the dynamics of the outbreaks. If I'm going to have an educated guess, it will be very similar to the influenza. It will be healthcare providers. It will be people with high comorbidity health conditions, whether it's heart or heart disease or lung disease. These people would receive it first, and it will be triaged down into who would be less in need for it.
So your message to us is continue with all the precautions, continue with the masking, hand washing, following the guidelines around the group sizing. Anything else you'd like to add in the last minute or so of our program?
Again, the 3 W's that helped us: washing hands, watching our distance, and wearing a mask correctly. They kept us safe, and they are very necessary to be there top mind for all of us to ensure that we'll be safe, our families, and the most vulnerable of us, people with older adults and heart disease, lung disease, other conditions. And again, be informed, be concerned. That's something for all of us to have, to deliver on ensuring safety for all of us.
I can't thank you enough for being here on this program. I know how busy you are, and I appreciate you being here. I certainly wish to extend you an invitation to come back again. I'm sure there will be ongoing information that you'll have to share as we move through the fall season, and soon, hopefully, a vaccine being available. Thank you for your time, and thank you for all that you do for us. Thank you to our viewing audience for joining us again today. Please take care of yourselves and help each other. Thank you.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Hi, I'm Sharon Skelly, host of Community Close-Up. Please watch us every week here on Rogers TV.
It was our 35th anniversary. To celebrate, we were on our way to Mama Rosie's, where we had our first date. That's when we heard coming from the radio.